Going live today to talk about gut issues and how gut issues are related to gallbladder disease. And oftentimes you don't even know it because your doctor is not telling you this, your doctor is not diagnosing this. And why is that so? Well, it is hard to diagnose gallbladder disease because it often comes with a lot of different types of symptoms that are really nondescript, that seem like other issues like GERD or acid reflux or other types of gut issues. So you and your doctor may be looking in the wrong place, and you may not be looking at gallbladder disease, which is an important thing to take note of. And today in my live, I'll talk a little bit about this. How can you work with myself or your doctor to figure out if you have any gallbladder issues? So first of all, if you look at my post today, you'll see that there's a number of issues that are related with gallbladder disease, and that includes things like bloating, acid reflux, heartburn, GERD type symptoms, car sickness, and nausea. This is a really common one. If you get in a car and you get really car sick, this can really mean that your liver and your gallbladder are really congested. That is actually one of the questions on our Cleanbody assessment. And if you have that pain and that nauseous feeling when you get in a car, this can really mean that your gallbladder might be really congested and your bile ducts are really congested as well too. Excess gas is one of those symptoms as well too. So as you can see, these are really nondescript. It just kind of seems like, oh, these are some of the regular symptoms, gut symptoms that a lot of us have. Unfortunately, these can be early signs of gallbladder disease. If you guys don't know what your gallbladder is, it's a little pouch that kind of sits right next to your liver, right under your right rib right here. And a lot of times you might get like a little pain or a little cramp even. And you might, I used to get this when I had really bad eczema and my gallbladder was super full. I had gallstones, I didn't even know it. And when I would run, I would get this cramp right here and it would hurt so bad. I didn't really understand why until I figured out that I had a really congested gallbladder. And what happens is you might get these really, symptoms that kind of seem nondescript, like the bloating and then the right-sided cramp and pain. I was super car sick. I would get really car sick to the point of throwing up when I had really bad eczema and I was really basically unhealthy. And come to find out later on that I had gallstones and no doctor ever told me this. And really a big part of my healing process was flushing out my gallbladder. So what does your gallbladder do? It's a little pouch and it really holds, it's like a storage compartment for bile. And if you follow me, I do talk about bile a lot because it's really important. Bile is created by your liver. Think of it as little buses that help the toxins to get out of your body via your stool. And it's also what makes your stool look brown. Okay, so if you're constipated, if you're bloated, all of these signs that tell us that you're not making enough bile. And so a regular adult should be having, creating at least like 1 to 1.5 quarts of bile per day. And if you have any gut symptoms, skin symptoms, psoriasis, eczema, high cholesterol, constipation, all of these problems, acid reflux, potentially you're only making like a cup or less, so not enough bile. Why is that? Well, the organ that makes the bile is called your liver. And if your liver is really taxed, because most of us really abuse our livers nowadays, then you're not going to make enough bile. You're not going to be able to make enough bile, and then you're going to have problems because those toxins are going to overflow into your body instead of get out through your stool. Now, someone earlier asked, what if you don't have a gallbladder? Well, you got your gallbladder removed, right, via surgery. This is a big problem. So if you guys have any of these symptoms that I'm talking about, all these gut issues, I do want you to think about your gallbladder. This is not something your gastroenterologist will think about first. They're going to think about so many other things, giving you drugs for your acid reflux and your heartburn. They're going to think about giving you, all these different medications. They may think about, like, do you have a parasite or something like that? And they really won't think about, well, are you just not making enough bile? Is your liver congested? And so what happens is you kind of keep living life with all of these symptoms, with acid reflux, with bloating and car sickness, not realizing that this has to do with potentially your gallbladder and congested bile. And you just live with it. All of a sudden, let's say you go out to a dinner, you have a big fatty dinner like a steak dinner or a Mexican dinner, and you end up with a gallbladder attack. You end up in the hospital and it's time for surgery. And this is the problem with our conventional model in terms of gallbladder disease is we're really, it's hard to diagnose, and we're really ending up finding out about it when it's really too late and it's time to remove the gallbladder. So what happens when you remove the gallbladder? Well, when you remove the gallbladder, you no longer have this pouch. And because you don't have that pouch, your bile is still going to get stored. It'll get stored in your small intestine, but you may not be able to store a lot of bile. And so, you may have lower bile output, and that's what I was talking about, is that we may have some issues there. But also, you needing to remove your gallbladder indicates that you likely had gallstones. And so those gallstones are not just in your gallbladder, but they also can be in your bile ducts. And it's kind of like, think about pipes in your liver, and those pipes are super congested. And imagine that you're trying to get out all these toxins, and now those pipes are super congested, so you can't get those toxins out. Someone was asking about polyps. Yeah, polyps can occur if there's a lot of congestion in that gallbladder, and then you can potentially develop polyps. So polyps can be a sign that there's a gallbladder issue and that we need to cleanse. So how do we fix this problem? Well, first of all, how do you know if you have a gallbladder disease? Well, all of those symptoms that I put in today's post, check that out. It's, bloating, acid reflux, heartburn, pain under your right rib is really common. If you guys get like a cramp or a pain under your right rib, this is really common. And, you should work with myself or a naturopathic doctor. Your conventional doctor, conventional gastroenterologist may not treat this yet. Okay. You can also look at your yearly labs and you can check a value called bilirubin. I often find that a lot of my patients will come to me with maybe like eczema or psoriasis or all these other kind of chronic disease issues. And then I find that their bilirubin levels are high. And I ask them, well, what did your conventional doc do about this? And conventional doc didn't really do anything because, not necessarily treating from the root cause of the high bilirubin without other associated problems may not flag your conventional doctor to kind of take any action. For a naturopathic doctor, this is really different. If we see high bilirubin should be excreted out of your body and not kind of staying around in your blood. So if those levels are high, then this could indicate that you have those congested bile ducts. You have congested bile, you have a gallbladder that's full, potentially you have gallstones. These are all possibilities. From there, we may want to do some imaging, and we may want to see, okay, do we see the gallstones in imaging? Sometimes it's hard to see in imaging. Sometimes those gallstones are super small, they're in your bile ducts, and they're hard to see. If you get that pain there, or if you push on that area right under your right rib and you push on that area and you have a pain, then that can also be indicative of gallstones or gallbladder disease. So what do we do? Well, I am going to be talking about all of my protocols to flush out your gallbladder, your liver, your gut, and your kidney in my free live masterclass tomorrow. I'll kind of be showing slides and giving you a lot more in-depth information. So if you guys want to join my masterclass tomorrow, it's Tuesday at 4 p.m. Pacific Standard. You can sign up for that masterclass in the link in my bio and just click free masterclass. But I'll kind of go into a little bit right now. So I like to say that everybody has a detox funnel that's made up of your gut, your kidneys, your liver, your gallbladder. These are all your detox organs. This is how your body releases toxins out of your body. And in order to flush it, we have to flush all those parts. So we have to really clean up your gut. We have to clean up your kidney, and we have to then clean up your liver, and then finally we flush your bile. And when I'm saying flush bile, we actually flush the bile out of your body. And it's a procedure you'll do at home. You'll do part in a wellness center close to you, and then part at home. This is only for adults. If we identify that there's gallbladder issues in a child, which is very possible, I do flush them out in a different way. We use more gentle things like homeopathy and gentle herbs, etc., to flush them out. But flushing out the bile is one of the best things you can do, because that bile is connected to toxins, and by flushing it out, you're clearing the way so that those pipes can be cleaned, right? So I like to say it's really like you're driving around your car and you've never flushed out your transmission fluid. If you don't flush out your transmission fluid for, you wait 2 years or 3 years or 4 years or 5 years, what's going to happen is heavy metals are going to build up in your transmission, and your transmission will break down. So that is why our gallbladders are breaking down. We're needing surgeries to just take them out of our body. And, the conventional thought is, oh, you don't really need a gallbladder. It's going to, everything's going to work fine. Well, if we didn't need a gallbladder, we probably wouldn't have it, right? We do need the gallbladder because it actually stores that bile, and that bile is really, really important. So when people don't have their gallbladders, I do find issues happen down the line, like constipation, acid reflux, skin disease like eczema, psoriasis, because you're not getting those toxins out of the body the way you should, okay? So it can be a really big problem, and something that I want you guys to think about. And if you have some of these symptoms, to really kind of think about, okay, I maybe should get myself checked, whether, you see a naturopathic doctor locally to you. And we also treat virtually as well too. So we can support you in terms of asking your local doctor for those labs. Again, like a comprehensive metabolic panel to check your bilirubin levels are really helpful. And if it's above 1.0, to me, that's higher, on the higher end, and it can indicate that there's some congestion in your gallbladder and your bile ducts. So some ways to look at your labs are to kind of look at it from more of a functional perspective instead of always looking for kind of disease. So maybe you don't have full-blown gallbladder disease yet, but we want to prevent that, right? So if you're getting car sick when you are in the car, this is really, really clear, and my experience on this is when I had really severe eczema, I used to get car sick, and I used to have a pain between my shoulder blades and my back. And those two things are functional markers. They can kind of tell us, ooh, okay, you may have some referred pain from your gallbladder, and that car sickness could also be because your gallbladder is really congested, okay? Also related are things like hormone dysfunction, like thyroid issues and PMS and other hormone issues, because your hormones really get metabolized the same way fat does through your liver. And so when your bile ducts and your liver are all congested, you also can't metabolize those hormones well. So as you can see, gallbladder disease it trickles into a lot of other different symptoms. So it's something to pay attention to, okay? And someone's saying, I definitely have digestive issues and get little patches of eczema when I eat certain foods. How do we confirm if the gallbladder is congested, and how can we support it or fix that? Great question, Mama B. Yeah, I would maybe suggest starting by coming to my masterclass tomorrow so you can kind of learn a little bit more. And, you can look at your yearly labs and just see what your bilirubin levels are. See if they're above 1. If they're above 1, that could indicate some congestion. And my protocols in my Cleanbody program are meant to flush it all out. And so if you go to the link on my profile, you'll see that I have a course if you just kind of want to learn about it. And you can also schedule a discovery consultation with me so that I can kind of analyze your situation, tell you what's the best approach in terms of maybe ordering some labs. And then if we order those labs and we kind of figure out, okay, there's a lot of congestion, we can coach you through the process. So I have a coaching program. I also have a medical program, so I can be there the whole time really guiding you through the process. My story on this is I became a naturopathic doctor because I had severe eczema all over my body. And I had that since I was born. And really, my gallbladder was congested ever since I was born. I didn't even really know it. But what happened was, like, I would run and I would get this cramp here, and I would eat like a really fatty meal and I would get this cramp here, and I just like had no idea what that was about. I was like, oh, okay, it's just, that's what happens when I eat, my tummy hurts, and I was a kid. And come to find out later on, it was exactly where my gallbladder was. And when I did the flush, I really softened up potential gallstones that were in my body, and we kind of flushed all of that debris out of my body. And 3 flushes in, my eczema was gone, and it's really been gone ever since. So these flushes are quite amazing. They were the magic bullet in my healing process of clearing myself of not only eczema, but IBS. So I had all these gut issues, and then I had headaches and migraines, and I had this car sickness issue. I had hormone issues, and oftentimes you're not going to see these issues stand alone. You're going to see them all together, all lumped together. And in conventional medicine, we split it all up, right? We send you to a gastroenterologist, we send you to an endocrinologist, we send you to all these different doctors who are specializing in the different parts of your body, not really understanding that all of it's connected, right? So if your gallbladder is congested, there's so many things that are going to happen there. You're not going to be able to detoxify well. Your gut's not going to be working well, right? Your bile is part of what makes up your stool. And so I would say, like, one of the first signs that your gallbladder is congested is going to be gut issues. It's going to be skin issues. It's going to be difficulty losing weight. It's going to be nausea and car sickness and headaches. Those are kind of the first signs that gallbladder is really congested. So it is my mission now, because my healing was so phenomenal. 0 eczema. I would never be wearing this short sleeve dress when I had eczema. Like, this whole arm was covered with eczema, and I wouldn't show my arms. And after doing 3 flushes, like, it's just all completely gone. And it's almost been a decade now. And I've been eczema free, IBS free, migraine free. Everything free, right? And that's when you flush the transmission fluid, oftentimes the car starts working well again. And it's really just about cleaning up your system. And that bile and that gallbladder is so important. So if you want to, pay attention to this, I would say ask your doctor to run a comprehensive metabolic panel, see what your bilirubin levels are. Or if you want to work with a naturopathic doctor, even better, because the naturopathic doctor will have a better understanding of this. And of course, I am available virtually for people, in the U.S. and I can make suggestions for labs. I can also order those labs for you as well too, especially if you're in California, because I am a licensed physician here in California. Okay. Does anyone else have any other questions about gut issues, about how it's related to gallbladder disease, about gallbladder disease itself? One last thing I want to say while I'm waiting for some questions here is, if you don't have a gallbladder, then you really need to flush things out, because if you've already lost your gallbladder through surgery, then your body is already telling you there's a lot of congestion here. And removing the gallbladder is not the answer. It's only the answer to not giving you, pain in your right side, or that nauseousness. It's not the answer to what's really going down in your body, and you're eventually going to have more and more problems if you don't flush out, okay? So you do want to take care of this ASAP, especially if you don't have a gallbladder, okay? Once you flush, are you able to eat whatever you prefer, or do you naturally avoid the foods that initially cause you some digestive upset, and how does it get congested? Mom, that'd be a great question. So once you flush, you're really going to have a much easier time really tolerating some of the foods that are more difficult to digest. So that would be things like fat, that would be things like gluten and dairy, and you'll tolerate them better. Once you flush, sometimes you don't even want to bring those foods back, because you feel so good that you don't want to congest your funnel again, right? But so what do? I live on an 80-20 rule. 80% of the time, I really don't eat anything that would fill my funnel, congest my gallbladder. I'm eating really clean. I would say 10 to 20% of the time when I am, out with my friends and maybe there's a little gluten here, a little dairy there, a little sugar and a little wine, that I am kind of living outside of my normal kind of routine. And because my funnel is so clean, my pipes are all clean, my body easily just digests all that food and boom, 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 boom. I never have those problems anymore. Now, if I'm really bad and I really abuse my diet, and let's say instead of 80-20, it's more like the reverse, let's say 20-80, which never really happens. But if I did do that, then it would all get congested again, right? Because I'm filling it up more and I'm putting more pressure on my detox organs, and my detox organs aren't really, our detox organs really weren't built to handle all of the toxins of today's world. And it's really unfortunate that we have so many toxins in our world today that our bodies are needing to deal with these toxins. So we need to do the best we can in terms of lowering the toxin exposure. I will be talking about that at my masterclass too, is just kind of like, what are the toxins that we're exposed to that we don't know about, and how do you identify them? One thing you guys can do is go take the assessment on my website. It's free, and that assessment will kind of give you an idea of how full your funnel is and how much you might need to detox your, what I call detox funnel. And with some simple protocols of cleaning up your gut, cleaning up your kidneys, cleaning up your liver, and flushing your bile if you're an adult, okay? I may have missed a question that went on there, so if you want to ask it again, I forget what that question was. I'm happy to answer any other questions about gut issues, about gallbladder disease, about flushing out the bile, etc. I think someone's question was about how does it get congested? How does the gallbladder get congested? Well, lots of things. So poor diet, eating a lot of fat can really congest the gallbladder. Eating, just kind of toxic foods that are difficult to digest can also clog that funnel as well too. And then just being exposed to a lot of toxins really causes your liver to be so taxed and overwhelmed that it's really hard to potentially create bile, and therefore then the bile just gets congested. Okay, so it's really about how many toxins are we putting in, how stressed are we, and I'll talk a lot about this in my free masterclass tomorrow. So if you guys wanted to join that, I'll kind of break it down with a lot of different slides so you can kind of understand further. Okay, what does it mean to have a lot of fat around your liver? So Tuto. This you may be talking about fatty liver, and what fatty liver is there's basically fat growing it's your liver's so congested that you'll see fat just on the liver basically. And you can take a look at this if you actually even just Google fatty liver. You'll see what the difference between a fatty liver and a normal liver looks like. And that fatty liver is because there's so much congestion that the body is no longer metabolizing that fat. And your gallbladder and your bile is so related, thank you for bringing this up, to the high cholesterol and fatty liver problems and even diabetes problems, etc. And all of it is related because the bile really helps metabolize those fats, and that means get them out of the body, metabolize it, utilize it, and get it out of the body. So when you are growing fat around your liver, this is really something that's telling us absolutely 100% if you have fatty liver, your gallbladder is congested and we need to flush it out. I've had amazing stories with patients where their liver enzymes were extremely high, like in the hundreds, and they had fatty liver, high cholesterol, diabetes, etc. And we flush them out and those numbers go right to normal within 3 months. It's amazing, with no medication. And it's really just, if you guys think about it, it just makes so much sense, right? Like if the pipes are congested, obviously the fat is not going to be able to go out of the body. So we clean the pipes, now the fat is able to come out of the body. And it's really simple when you kind of break it down. And what we often do in conventional medicine is we give a drug to address the end result. And the end result is the high cholesterol. But that's not exactly the problem. The problem is that you're so congested in your liver that that fat is not able to metabolize out of the body, okay? And someone is asking, does healthy fat like omega-3 congest the gallbladder too? There's a possibility. Like if your body is having a hard time metabolizing fat in general, even those good fats can sometimes be a problem as well too. But I don't want that to stop you from doing, ingesting omega-3s, because those omega-3s are really important. But if your liver is so congested that it can't even metabolize those fats, you may not even be utilizing them properly. Is a castor oil pack sufficient? Castor oil packs are awesome for helping the liver to kind of stimulate its process and get things moving, but it is not sufficient. That's a great question. It is not sufficient. It's really only something that will help the process of detoxification. I do like to use castor oil packs frequently, but again, it's only like something that will help the process. It will get things moving a little bit faster, not the same as flushing out your bile, okay? Thoughts about using liposomal glutathione? I love liposomal glutathione. It's actually in one of my protocols, actually two of my protocols, because it's so important when we're detoxifying. We are going to be causing oxidative stress and potentially cellular damage. And so glutathione will protect the cells, and glutathione is necessary to help with the detoxification process. So again, it's just another thing that's helpful in the journey. Glutathione by itself is not going to do the job, right? So we really need to do it along with a whole protocol that's really geared towards you. And that's what our program is really designed to do. It's kind of what I wanted when I had really bad eczema and I had gallbladder issues but didn't even know it. I wanted a doctor to assess me and like, give me all these labs, let me know what's really wrong with me, explain it to me so that we can really get down to the root cause. And that's what we do in our program. And so your ways to potentially kind of learn more, we have a free live masterclass tomorrow, Tuesday at 4 p.m. Pacific Standard Time. There is a free assessment on my website. You could also do that. That takes about 10 minutes. It's really in depth, but you'll learn a lot about your funnel and about, the pillars of health and things that you need to really kind of do to bump up your health. And then lastly, we have a discovery consultation, and that discovery consultation is where we can meet and I can really analyze what's going on with you. Hopefully you can upload your labs that you've done with your doctor previously, and I can really see what's going on there and kind of give you my feedback, and then kind of design something that really is appropriate for you, your age, how many symptoms you have. What would you suggest to do if there's a small polyp? Removal was suggested. Maribel, I think, removal is an option, but I think the question to me is always why? Why do you have a polyp there? Let's fix that problem, because if you just remove the polyp, does it not make sense that it's just going to come back? The reason why it was there is not gone. We haven't fixed that reason. And that's my problem, is like, we're never getting down to the root cause, typically in conventional medicine. And I shouldn't say never, but I say, with a lot of issues like gut issues and skin issues and headaches and migraines, we're just giving medications to silence the symptoms rather than really getting down to the root. And getting down to the root for that person would really mean that we clean up that liver, gallbladder, gut, kidney, the whole detox pathway, okay? What causes a fatty liver? Yeah, so I talked about this earlier. So the fatty liver is that your liver is really congested. It's overburdened by toxins. It potentially can't make bile. It can't help metabolize fat anymore. So instead of that fat being metabolized, so what does that mean? Broken down, let's say, and get out of the body, that fat just stays around in the liver, and then it just starts growing on the liver, and you can just kind of see the liver is like a big ball of fat instead of a liver, right? And could it be caused by constipation? So constipation is probably a result of the liver being congested and then vice versa. It's hard to know which came first, the chicken or the egg. I would have to really assess you to understand which came first. Your story is so important to me. So if we meet for a discovery consultation, I want to hear the entire story, because then I can kind of piece together the puzzle and really understand where did it start and how do we get to the root is really my question. So it's hard because the gallbladder liver issue will cause that constipation. Constipation may cause the funnel to get full as well too, okay? If you've done keto, could that have contributed to fatty liver? Absolutely. This is an absolutely here. I have treated a number of patients who did keto because they were trying to lose weight, and all of a sudden they now have abdominal pain, they get bloated, they're constipated, they have eczema, they have psoriasis, they have all these problems that they didn't have before because you're filling your body with fat and your body potentially doesn't have the means to metabolize all that fat. So it's absolutely a possibility. I would say that's not true for everybody, but I have treated a lot of people where the fatty liver could potentially be a problem, okay? Oh, hi there. This is one of my patients. Hi there. Do you still work with clients one-on-one? Yes, I do work with clients on one-on-one. What we've done recently is that we are treating virtually, and that really allows me to treat kind of all over, which is really great because one of my missions is to really educate people on this idea that we need to clean our gallbladder and we need to flush it out. So I am working with people one-on-one, and if you're my past patient, just go ahead and either call us and leave a message and we'll get back to you, or you can go to our patient info site, okay? I've got hypothyroid and what causes, okay. So as I said earlier, you might have missed that part, is if you have fatty liver, then what will happen